Hi, thanks for joining us for this community conversations out in healthcare, LGBTQIA+. We have a great panel of women here today to talk about their experience with healthcare. I'm very excited about it. I am Annie. I am the manager of Member Path here at Gilda's Club. I'm also a licensed marriage and family therapist, and I think our equity and inclusion is a big thing in the world in general, but I think in healthcare we have a long way to go as well. So will you guys introduce yourselves? Maybe say why I picked you guys or why I asked you to be here and who you are. Go.
I'm Nancy Heck. Annie picked me because I'm old.
Not true.
Okay. I'm not sure why she picked me, but anyway, I'm here with my spouse, Kim. I'm the one who had cancer. I had sarcoma in my left thigh. Kim and I have been together for 36 years and married since we were able to be married. I think that was in 2008. Right? You're next.
I'm Kim. I'm here because Annie sent the email to me as well. No, I'm not old at all. I'm connected with her, so that's why I'm here.
She's only a year younger than me.
Anyway, I'm really glad to be here. I haven't met anybody, but it's just been lovely the last 5 minutes listening to everybody chat and looking forward to this.
I'm Angel. You want to go, Carly? Okay. I'm Angel, and I am currently dealing with stage 4 breast cancer. So that's one of the reasons that Annie asked me to join to kind of share my story. I have a partner who is doing other things right now. We've been together 23 years, but she's been through it all with me.
I'm Carly Kreiser. I'm a licensed social worker. I'm here because I am also an out woman. I've been out since I was 16, and I also really believe in promoting these conversations within communities, and I am a group facilitator at Gilda's for the young adults, and I do some writing workshops, and I also do post-treatment, facilitate post-treatment group, and been trying to build and have been trying to, and Annie, building a once-a-month Pride group. So that's why I'm here to share a little bit about my experience and be part of the bigger conversation of inclusion, so, and especially within the medical field.
And I'm Haya, and I think I've been picked because, well, the combination of, I'm a 2-time cancer survivor. I started with Gilda's back in January 15 of 2015. So it's been a little over 6 years. My wife was alive at the time. We were together 31 years. She had passed away just as I finished my chemotherapy. And that was a very difficult time for me to have that, but the 31 years were wonderful. But then I had breast cancer in 2018, just as I was thinking I was going to leave Gilda's, that I was going to move on. And I've decided I'm a long-term member of Gilda's because I think it fits me really well. I love doing all the art that I've been doing there. It's really built me as a person. And I really now am happy to be able to help with looking at how it is to be a lesbian within the medical community and getting my health taken care of.
It's a good panel. I'm glad you're all here. It's a good fit. So I guess as a straight person, my first question for all of you is, does identity or sexual orientation even enter into the doctor's office? Is it a thing? Like, is it a concern? I know it's a concern, but you know what I'm saying? and how does it impact you, or how have you dealt with it?
Mike,
I can answer. Oh,
you go ahead.
Oh, I was just going to say, in the beginning, when I was first diagnosed in 2008, it was a little uncomfortable because I wasn't sure. You hear horror stories about partners not being able to go into the rooms with you, and attend doctor's appointments, or be there with surgeries or hospital visits and things like that. And so I was very fortunate, though, that the day of my surgery, they asked me who was going to go back to the room with me, and I said, well, I'd like two people, one my partner, one my mom, and they said, okay, come on back. So I haven't had any issues, and I think part of that was that I was just not. At that point I was done hiding or apologizing for who I am. So.
Yeah.
I think I've kind of experienced the same thing. I mean, Donna, my partner, worked as a mental health nurse for many, many years. I mean, until she retired and then passed away. But and I worked the medical system for a long time. I've been involved in pharmacy. I've been involved in reception. I've been involved in counseling. So I've had many ways of dealing with it. Actually, the only time that I've ever been, and it wasn't really medical, it was my job as a vocational rehab counselor that this is back though, you've got to remember, it was like late 80s, and I was told, this one gentleman, I'm not working with no lesbian. And that became a big thing for me, and I just was out all the way then, all the time, because I was not going to let anybody do that again to me. As far as my health, I mean, I'm just thinking they have been, all my doctors, I've had the same primary doctor, first of all, for 35 years. She's going to be retiring the end of this month. So it's like, oh my God, my mom is leaving, But she was also Donna's doctor, and actually the day at 8:30 in the morning, after my wife died at 11:30 at night, she called me to say, I'm so sorry to hear what happened.
That's nice.
And so, I mean, that is something I'll always remember. There was more difficulty actually getting into the hospital with her. And I'm not sure if it was just that person that was working the front desk when we brought her into the emergency room. I was not allowed to go back with her, and they kept saying, you have to talk, or they have to talk to her first. I said, she can't talk. You need to have me there. I'm her wife. I'm legally married. And, so that was really difficult. But beyond that experience, I mean, I was treated very well once we got into the hospital with her, and all my treatments have been, the only discomfort that I had is the one primary doctor who only had women doctors, only had women patients for a long time, started having men patients. And because they became part of a greater medical company rather than individual, they had to have male nurses, which they finally fought and got rid of. But I mean, it was really uncomfortable for me around the men. And I don't know if that was because of them or because of myself and what I'm looking for.
And for me, it wasn't an issue. I'm totally out. And so I would, just say as a matter of course to anybody I was working with that, this is my spouse and we're legally married. And it was never an issue.
When we moved here from San Francisco in 2000, my primary care physician was a lesbian. Still is, but she's not my doctor anymore. So, but that was a plus, along with being a great doctor. That was a huge plus. I'm not sure why. I don't know that I would have issues. Well, Yeah, all of my doctors have been women. And so that's an interesting question that you pose about, is it uncomfortable to be around male nurses or male doctors? Not just the being lesbian, but the gender thing as well. And that just triggered. Yeah, I've only exclusively gone to female doctors since I can remember.
Well, my oncologist and my surgeon were both men, and I was fine with that.
Mm-hmm.
And they were fine with me.
And there was never an issue that the U of M of me coming in with Nancy and being included, and even in the emergency room of like spouse, with my name and number, and that was just a total given. But that was in 2018, so we're talking recently.
It might be interesting if we were doing this panel and we lived in some place like Missouri or Mississippi or Utah. Might be a different experience.
Yep, I'm sure it would, even in 2018. Yep.
Absolutely.
Mm-hmm.
I think in my experience, what I see it when I go to the doctor, especially maybe just my age and stuff, but like I had my OBGYN would always at the end of our appointment. So what are you gonna do? I see you're not on birth control, and it's just like, I told you like I'm with a partner, a female partner, and that's right. And then 2 years later, and it's like you don't see the person all that often, and I didn't have to, just it was yearly checkups at that time. Again, oh, I see you're not using any protection. So what are your plans? And it's just like I literally told her, I said, and I'm the type of person that has empathetic embarrassment. Like if that person is feeling uncomfortable, then now I'm feeling uncomfortable for them being uncomfortable, and just that whole like awkwardness. So I told her, I said, could you literally write it in my chart that I am, I'm with a female partner, and I will update you as needed, because it's an awkward question to keep asking me, and it's assuming that I'm straight. Well, because that is just where the mindset is. And I think the other thing that I wonder about is that because I've been out since 16 and I am now married to a woman, it's like my doctor has never asked me, how's the fam? How's the wife? Like, I don't know if that's a typical straight conversation that practitioners have with their patients. It's never been my case, and I've had this same woman. Now I just got a note that she's retiring. So now I'm going to go through this again of like, I feel in 2021, I'm totally like, I'm married, put it in my chart. You know what I mean? Like I'm ready to see those things. But yeah. When I was younger, it kind of made me feel awkward, and it almost made me have a sense of shame for being gay, like, oh, like I'm the odd one now, or, that type of feeling of being the minority, I suppose, in that sense. So we'll see what happens this time around. I'm actually more curious than I don't think I'll feel shame this time, but I'm curious to just see how the doctor and I get along, and how she assesses my whole person,
Mm-hmm.
I said she too. That's funny because I've always had female practitioners since ever too. I've never had a male. So it's a thing.
Well, I think that might be a woman thing though, because I've never had a male doctor either.
Yeah.
Right?
Yeah.
Actually, I have to say, I do have one male doctor, my endocrinologist, who I saw this morning, very young man, probably, early 30s, just got married. That doesn't mean that, that was a biased statement there of how old you are when you get married. After all, Don and I didn't get married, legally until whatever. We went to Canada first, but I have to give him credit. He has been very gentle, and maybe again, I don't know if it's because I'm so out that there's no question. And so I don't know if when somebody like myself is so out that it makes other people comfortable, because it's like they don't have to guess anything.
Mm-hmm. Yep. Yeah. I have My first oncologist was a male, and I loved working with him. It was really sad when he decided to go to the Mayo Clinic. So, you know, I have a female oncologist now, but it's different, like with COVID and things like that, and I don't see her as often. And when I do, it's via Zoom, so I don't get to build that relationship like I had with my other oncologist. Not that, you know, you want to make a relationship with an oncologist, but if you're going to have it, you might as well have a relationship.
Mhm. You should like the person. Yep. Who's
Just
working.
the person,
Mhm.
for sure.
Mhm.
Yeah.
I think over the years, intake forms have changed for the better. I also was in healthcare as a physical therapist, and the intake forms eventually evolved to where it had a space for saying whether you were gay or straight,
Mhm.
or, you know, married and was your partner male or female. And that was not the case 20 years ago.
That brings up, like, thinking of it as a mental health practitioner for my full-time job. It's also a dynamic of like, how do I discern like what client I can be my full self to, you know, because you talk about ethics and you talk about all this training, and it's 2021, right? So I should feel safe. You know, if a client asks, "Are you married?" Yes. You know, it's you, and it's a female. Like, there's still that discord, or kind of like, well, what's your intention? Well, what do you mean, what's my intention? You wouldn't be asking a straight person what their intention is for saying who they're married to. So,
Yeah.
you know, I have to work with that as a practitioner in making sure. It's almost like politics. You know, you don't want to be assigned someone and then you don't tell them, you wouldn't tell them your political view, because then they, you know, that might not align. But when it comes to my sexuality, it still seems like I have to be acting a discernment in that way. And I have been harassed by clients I've worked with, like you were saying, Haya, where it's not harassed for you, but for me it was. It was, you know, a young male making derogatory marks about, I've never had good men before, and we'll just put it in those terms. And so I had to like take that in and be professional, but yet I still grapple with that as a professional and as taking it a little personal, you know, like it's hard not to feel, you know, like you got darts thrown at you sometimes and you're just trying to show up ethically, I suppose.
Yeah.
So that's just something, twisting the view from a client to a professional that I still work with. Yeah.
Yeah.
So closeted, I guess, to clients
Yeah.
for the most part.
You know, I would like to just add, as you were talking, it made me think about how, yes, this is LGBTQ plus, A plus, whatever. And I realized normally in something like this, we would have our pronouns.
Mm-hmm.
Mhm.
And
Oh,
actually, I just recently have accepted as myself, even as they, them, because I find it very frustrating to have to be asked all the time, you know, on these forms and whatever, and especially again in the medical thing, you're constantly being asked, you know, do you consider yourself male or female? Do you consider yourself, you know, I think that I've been asked a number, you know, are you married? Are you not married? And all of that is actually, I'm realizing the discomfort that I'm having as I'm growing in myself, is accepting myself more wholly.
It's a good point. We should have done that. You're right. We can rename ourselves now if we want with our pronouns.
I'm going to do mine.
Nancy, you had something you were going to say? It sounded
I
like.
just wanted to say about what Carly said, that I had the same issue too. It was kind of left. I kept a professional curtain, and I stayed behind that curtain with patients. It just, they were not privy to my private life at all. And that says sometimes could be uncomfortable because the nurses are the age to be talking about, you know, their son or their daughter or their husband or that. And I wouldn't join in that conversation with patients. I don't want to go there. Other than that, I'm totally out.
Right. But it's not a conversation I have to have at any point in my life. So why do I expect you guys to have the conversation? Right.
Yeah.
Right.
But
I'm go ahead.
I think you go ahead, Angel.
Okay. I've been very fortunate. I think part of it was, again, I was tired of kind of living a double life. So when I was first diagnosed with cancer in 2008, I was like, life is too short. You know, you get a little different perspective when you have a cancer diagnosis. And I decided that I needed to be who I am. I needed to be authentic. And if people didn't want to associate with me, then that was fine. That, you know, that was up to them. And so it in interviews, not that I went out parading or anything like that, but at the time I was working at the airport, and it was, you know, pretty male dominated. Where I was working. Again, I didn't start wearing the rainbow flag or, you know, like shaving my head or, you know, doing anything like that. But as people would ask me questions, I would let them know, you know, because at that time, I mean, Kathy and I, again, we've been together 23 years. So my Caring Bridge site, you know, I made it known that my partner Kathy has been involved in this and has been supportive and things like that. And I named it. And, you know, now I'm a licensed alcohol and drug counselor. I've also gone to school for mental health. I've worked in with the LGBTQ community in chemical dependency. I'm currently doing that in an outpatient setting. And so that's nice. It's nice to be working in that community. It's also nice to work with a company that is affirming and accepting. And, you know, I mean, that's not, we have men's groups, women's groups, the LGBTQ, we also have a Native American group. So we're kind of meeting needs where they are. And so it's really cool to just be able to just, again, be me and not have to worry about that. But I work with clients who do worry about, you know, and have been treated poorly because of who they are. That's hard.
So Kim, this kind of makes me curious. How did you know that your doctor was a lesbian? Like, how did that come up in the conversation in the workplace?
I think it was a referral from another friend of mine. So I didn't screen or ask her point blank. But yeah, in passing conversation, I knew that she mentioned her spouse and Nancy also, yeah, for a while. So she also, yeah, she's wonderful. She worked in the international clinic travel kind of stuff, and she grew up off and on in Thailand, in Chiang Mai. So when we went for our Nancy's 60th birthday to Chiang Mai to go to a elephant conservation camp thing,
Cool.
She knew all about it. She knew the place, and so yeah, really great. But it is this whole the fact that everything, unless you're clearly saying so or you can't quote unquote pass, we're always by default straight in all situations. It's terrible in a care setting when you're most vulnerable to have to be put on the spot. kind of, it's just another reminder that we're not equal, and the default is not, we're other, you know, being anything other than cisgender or straight or whatever is other, marginalized. And I think I didn't experience being uncomfortable as a spouse at the cancer center and going through all these things, but I also didn't feel that there was anything proactive happening. You know, there could be a lot more proactive things going on for people that, yeah, maybe they did drive up from Mississippi, or maybe they are younger and they're at home with really bigoted parents, or whatever the case may be. It would be nice to see more proactive, an acknowledgement that the default is being marginalized, and healthcare professionals or whatever kind of taking that extra step to be more proactive, more welcoming. Because I think that acknowledges the reality. We don't want to acknowledge the reality that what half of this state literally got up, went to the polls, they didn't have to do this, and proactively said, we can't get married, even though it's already illegal. We want to put it into the Constitution that just something as innocuous as getting married. So that's the Orwellian reality, and they're still, half of those people are still around. And I think we don't really want that to kind of go away. And I'm in a privileged place because my family's very supportive, and I'm out, I'm retired. I don't have to pass or play games anywhere now. I'm financially secure. That certainly isn't the case for many people.
Yeah. Well, I'm bringing up like politics and government, like a story that I can quick share about, I guess, discrimination that happened to me is I went to Planned Parenthood. I didn't have health insurance. And so I was going to go get a physical because I heard you could get it for free. It's like preventative care. So, you know, for one, I'm nervous going and using a community resource anyways, because that in itself has its, you know, stigmas. And Planned Parenthood, let's not get started on, you know, just going there, you have protesters. So it's like, it's already unwelcoming. So anyways, I had the physical, and then I went to go check out, and she gave me a bag of birth control. And I, at the front desk, I said, no, I don't need that. And she's like, well, you did just get the physical, that the program. And I'm like, well, what do you mean? She's like, well, it's a government funded program that you get a free physical if you take this birth control. So, and I was like, but I don't need birth control. And so she's like, well, then I guess I'm just going to have to charge you like the sliding fee scale. I said, you're going to charge me right now for this PAP that I got because I'm not going to take the birth control? I said, okay, well then give it to me. I'll take it. And she said, well, I have to act with integrity. And you already told me that you don't need it. So I literally can't put you as a statistic for this program or whatever. So I think I had to pay like $55.
That's terrible.
I know. I left so confused. And, you know, I was probably like 19 or 20 at the time. So it's like, so that, you know, having that type of, you know, that experience ingrained in my head as a young person developing your sexuality and trying to figure out the world, you know, really caused some mistrust in the governing and of sexual health. It's like, it was definitely governed towards preventing pregnancies in straight folks. Mm-hmm. So because of my sexual identity, I had to pay for my PAP, y'all. I mean, what is that?
Better. Yeah.
I wonder if that's one of the things that would change now, though. I mean, it wasn't yesterday when you went in there, right? It was a while ago.
Yeah, and that's the thing is, like, I do see a lot more youth, like, gender binary, and really working on, you know, titles and inclusiveness and building that, you know, medical community of trusting folks. So it's like you said, I think Kim or Nancy, that it's come a long way, but it's still something that that other has to think about, that other people don't have to, but yeah. And Planned Parenthood, I have no idea as of now, so I'm not bashing them at all. It was just my experience. Yeah.
It's a good example or a bad example, but
Good example of a bad thing.
there you go. That's a better way to say it.
And it was a community resource is why I went, it was, so they're welcoming you in to utilize their services. And then it was like, oh, but it's not inclusive.
Yeah.
And the person at Planned Parenthood wasn't even embarrassed by.
Oh, she was mortified. I don't think she knew what to do. And she was young and like confused. Maybe she was an intern. You know what I mean? I think it was just this awkward, and I was like, well, just give me the birth control. Like, I really tried. Like, just come on, hand it over. Give me the birth control. But she was just really resistant. And I think I don't really know.
You should have told her you would go out and sleep with the man just so that you wouldn't have to pay.
Right? Be like, that protester out there?
No, for tonight.
Yeah.
I don't know. People trying to get me on birth control. I don't need it, peeps. So.
Well, hope springs eternal. Maybe that individual did actually go talk to other people there.
Yeah.
That we need to sit down and figure this out. This is dumb. Yeah.
Yeah. Hopefully.
I think the bottom line is, I think in general, we think of the world as we know it. And so these people that are asking us questions or saying things to us are coming from their own perspective of the world. Because I can think of times where I'm like, really? You thinking that? Because I'm coming from, a lesbian point of view, or I'm coming from, even, when I was very young, when I was 25, I was not sure who I was. I was going all different directions. And so I actually went and had a tubal ligation done because I knew I never wanted children. That was not something I wanted to do. And, nope, I think Donna would have been a great mom. I would not have wanted to do that. And this doctor was a male doctor, but he was actually very good at the time. He said, after talking to you, I really get the sense that I know this is true for you. So he had no problem at 25, so I could quit taking those birth control pills. But, later on, actually finding out it didn't make any difference. But I do think that we have to remember that, why would they think to ask certain things? Maybe we need to train our health people and other people to know to remember that not everybody's like them. But yeah, I think that's part of it.
Yes, I think that's great that he respected your wishes in that case. But like in the back of my head, I'm thinking, why is it any of his business if that's what you want to do with your body?
I think it was more that I was 25 years old.
So
I think he was just wanting to make sure that, because he wanted to make sure I knew that. I didn't feel intruded upon at all. But I think, what if I'm just a person who is enjoying being sexual, and 5 years later I go, shit, I can't have a baby now. Can you fix it? So I think it was more caring for me than worrying about, whether what I choose to do.
I had a doctor in San Francisco who sat, I think you separately, but said, look, you're 38, whatever it was. Have you thought about having children for that very reason? I don't want you 5 years from now to start thinking about this, because this is the time you need to kind of think about it. I'm not telling you to do it or not to do it, but this is the time. You can't wait too long to start thinking about it. So, and then, she was open to exploring what the options would have been had we wanted to do that. And I think she probably sat Nancy down separately and gave the same advice. But it was very much
Yeah.
in your situation, you have options, and maybe from her experience with other patients, you know, she.
I forgot about that.
Yeah. So I really
good.
respected that.
Allison Lavoie.
Allison Lavoie.
Yeah.
You might have to beep that out if you're keeping. Yeah.
No, she retired.
I was like,
That's
bummer.
okay.
And she was straight.
She was straight. Yeah.
Great doc.
So overall in this conversation, I'm getting the feeling that you guys have better experiences with doctors than not.
Yes.
Yes.
Hmm.
I've heard
We-
horror stories, but have not experienced them, me personally.
That's good.
Well, we'll
Yeah.
see what happens with my new doctor that I'm going to build a relationship with.
Right. Mm-hmm.
And me as well. I'm a little nervous about it actually because she appears very young. They're still waiting for her certification in Minnesota. She's been a doctor and a teacher in Ohio, but she's taught medical students. But I am pretty nervous after 35 years with one doctor.
Yeah.
So then, like, if I go to my doctor, if I change a doctor, it's no big deal. Nobody asks me about my sexual orientation. It doesn't come up. They ask me if I'm sexually active. I answer the questions. I assume they think I'm straight. But you guys don't have that same feeling.
Mm-mm. No.
What do you do with that? Do you add on to that then, or do you just go with it?
I just answer the question. I just say, you know, I'm gay. They still ask sometimes, do you have more than one partner? I said, no, just one partner. I don't mind the question. That's okay.
I don't think I've had that question in years.
What, how many partners?
Or just in my sexual life, period. I can't remember the last time I was asked.
For me, the thing that's front and center is Nancy being able to visit me or me being able to visit her. And of course, now that we're legally married, insurance. That just was a huge, we paid, I had a pension, I was with the federal government, and Nancy was not eligible for any of, and of course not for my health insurance either. So it meant that we both had to work all the time. Because like a lot of other couples, they could just, one person could stop working and collect on, you know, never ever do that. And then when it came to death benefits, if I died, she would get some, she could not get death benefits from the federal government before, that's only for legally married people. So nothing, basically. So we talked to this financial advisor like 10 years ago or something and said, well, what's going to happen? How can we replicate that? So they had me go out and take all these physical exams and buy like $1 bazillion life insurance policy that would somewhat replicate what most straight people just take for granted. We were paying hundreds and hundreds of dollars a month for that. And that was the first thing that we were able to drop when we were able to get legally married. But I don't think there's a lot of awareness of the incredible privilege, that's financial privilege that comes with being legally married. Yeah. And I feel ambivalent somewhat because I don't think anybody's health insurance should be tied to their marital status. I mean,
right.
Just, but since it is, it's just such a huge schism.
Yeah. And I feel so lucky because since I was able to be on her medical insurance and I got cancer, it wasn't a financial strain. But if I had still been working, I was retired when I got cancer. But if I had still been working when I got cancer, I would have lost my job, I believe. And I would lose my medical insurance except for COBRA, which is like super expensive. And then goes for a certain amount of time. And so the cancer would have wiped us out financially. Unless there's some law that you can't like let somebody go if they're sick. I don't know those laws.
I don't think so.
But again, like Annie, you said, it's not something a straight person would ever even think about.
Mhm.
Right.
Yeah, I think, even when my wife passed away, thank goodness marriage was the key to it all. Otherwise, it would have been a real hassle.
Yeah.
But everything just got turned over to me, so I didn't have a problem. But the fact is that, marriage isn't necessarily that simple for our, group of people. It's just, and, there's so many other things that get involved. It's not just, okay, let's get married. It's really a big venture. So I hear you.
So not so much the actual interaction with doctors as a spouse, but more the other stuff, the minutia of stuff that comes along with this that's not considered. Yeah, it's a lot.
Financial part's not minutia, it's huge.
True. Mm-hmm.
You don't have it, you're up shit creek.
Mm-hmm.
Yeah, I mean, an example for me is my dad took out a life insurance policy when I was 16 through an organization that are straight bigots. So and my dad at the time when he took it out, I mean, it's not like he was thinking that way, because people don't think maybe my daughter will grow up to be gay and their life insurance may not accept her morals or whatever. So there, I know legally now it's all paid in full or whatever. Like I'm set with my life insurance, but I actually kind of resent that it's through an organization that is outwardly against gay people, gayness, trans, So it's just this weird thing that I have to go through. It's like, will they give me my money? Like, would they give my wife my money, even though we're legally married? Like, they have to, right? There's no clause or something that within this organization specifically, they won't get some funding. Like, that still goes on in my head. But I'm hoping that now that I'm legally married and that is their legit organization, that they'll give me my money when I die.
But the current composition of the Supreme Court makes me nervous. And it looks like they may be poised to do away with Roe versus Wade.
Yeah.
We've got rights now.
Mm-hmm. Well, and that's a good point, is that all these favorable laws for equality, for gay marriage and all of that, is that set in stone, or can that all be taken away? And that's what to think about.
What happened to Kim and I is we used to live in California. I was raised in California, and in 2008 they passed legal marriage for gay people. So we got married, and about within 6 months. So
that was a Supreme Court decision, and a state Supreme Court decision
in California
said you couldn't discriminate, so gay people could legally get married. And in response to that Supreme Court decision, these yahoos, a lot of Mormons, for example, flooded it with Proposition 8, flooded the state, passed Prop 8. But it was so stupid and so poorly worded that it was not retroactive. So there was 9,000 couples that got married right after the Supreme Court decision. We were in limbo because Prop 8 didn't address us. It was only prospective, not retroactive.
Wow.
So we tried to get married again in Massachusetts, and they wouldn't marry us because they said we were already married. But we didn't know if it was going to stick.
They said we'd be bigamous if we did it.
I think that's sort of like our marriage in Canada. Thank goodness we didn't have, in 2000, I think it was 13 here that we became, Minnesota accepted it. I fought really hard for that, by the way. I went door to door.
too.
And I just, but yeah, it's still a concern, not so much for me, but it's still a concern that they could take that away anytime. I mean, I know that our previous president talked about doing that, and so it isn't like it's written in stone for the straight community that, you get married, that's your marriage.
Yep.
Mhm.
Yeah.
Yeah, there's definitely a fear in me somewhere hidden with that, with who knows who is going to take over and take rights away. And like someone said, like, how is it that an institution of marriage determines who gets to see me on my deathbed, who gets my money that I want to have my money, like who can be part of my health insurance plan? Like, that's all just simply ridiculous to me. And it's so important because if, as we all know, we don't know what's going to happen. So we need to have health insurance. We need to live in these institutions that they've created. So why are we excluded from them?
We're other. And a lot of people really don't like other.
Well, who wants to be called other? I don't. And that's something for me. I don't like the word lesbian either. I don't consider myself bisexual. I don't know. I say queer and I say gay, but those are just two words that have been given me. So I don't really know. I'm not straight. How about that? Can they just have a box like not straight?
Carly, I actually agree with you. I know I've been using the term lesbian, but every time I say it, I'm like uncomfortable.
It sounds like a medical condition that an old white man made up. That's all I'm saying. She's got the lesbian or something,
Yeah.
Now just have a French person say it, and then you'll like it again.
Yeah, that's awesome. Can you mock that for me?
Lesbian.
Lesbian.
Anyone can be a lesbian.
That's funny. Well, yeah. This is good conversation. We can go on for another hour, but I guess what the topic I want to switch to is what can society as a whole do to acknowledge this and help with these inequities that we've named today?
Participate in the electoral politics and elect Democrats, not Republicans. Or independents. Anybody but Republicans.
I would say networking and outreach, because we're all out there doing this work. So if we can just band together and not have to reinvent the wheel, as they say, like, working in the medical field and being part of the medical field in whatever way that looks like, what other community and agencies are out there doing this work already? And how can we just keep building and building from that foundation? And that's how I think change has happened so far. And bringing the kind of underground resources to the surface, right?
It goes
also just our own selves being out.
Yeah.
That we don't show, like, oh, there's something different about me, because I don't feel that way. I feel really strong about who I am. And, it's not like I have to hide anything. And I think that as a community, if we, show our own strength that, we're comfortable with who we are. I'm sorry if you're uncomfortable. I really am. But if I can help you, let me know, but I'm fine. I'm fine with who I am.
But I think that's in part why things are improving. They're so much better than they were 25 years ago, because we have come out, and so many people have come out. And so, like our nieces and nephews, we're Aunt Kim and Aunt Nancy. And you can't picture Aunt Kim and Aunt Nancy as some kind of horrible monsters, because we're Aunt Kim and Aunt Nancy. And the more everybody's just part of the family, the less that and that's what the whole thing, for defeating that proposition here in Minnesota that was going to change the state constitution, was having those personal conversations with people you didn't even know. Because once you talk to somebody and you just become a person, you can't demonize us. Well, you can, but it's harder to.
Right. Yeah, you can if you're not wanting to actually listen. Right?
That's right.
Yeah.
But in a way, if you're hiding, if you're in the closet, which is more upsetting to me now than almost anything, than these kind of Bible thumping, I won't go there, but just other gay people that are in the closet is very upsetting to me.
Yeah.
Because like there's one relative of mine that is in her kind of circle of friends, but what that does is this acting out shame. It's like acting out, living and validating that, you know, we're kind of dirty little secrets here, you know, and that I don't know how we as a queer community or address that. It seems to be taboo to trash people that are closeted, but it's really upsetting to me in this day and age. And I could name a number of people that are even in prominent places. And there was a guy, I think his last name was Dick something. He did a documentary, he's a straight man, about closeted Republican men, high up governors and people in the Republican, 10 years ago or something ago. And it was really interesting to me. And he only picked people that were rabidly anti-gay on the surface, well, like a lot of priests, but it privately are living quote unquote gay lifestyle. And he thought that was fair game. And even that was somewhat controversial to criticize people. And I don't get that. I mean, it's one thing to just be afraid and trying to be coming out. It's another thing if you're in a high office and you make a profession of going after other gay people. So I think that would be a nice thing to maybe younger people don't feel that way, but that's been a thing, ongoing thing that it's just sacrosanct no matter how nasty and vicious and anti-gay somebody is. Roy Cohen is a great example.
J. Edgar Hoover.
You just don't go out, you protect their privacy. So I'd love to see that change because I think there are, and I'm not talking about people that are somewhat innocuous, but just the ones that go after. And in the documentary, he interviewed some of these guys, and somebody said, well, why that happens is picture a playground where a bunch of bullies are just wailing on the weak one or the gay one. So the gay person that's passing sees that and says, well, the best protection I have is to lead the fight, be the meanest and the nastiest one. That's how I can keep myself safe. So it's a horrific dynamic. And that's a metaphor for, I think, what still is happening now. So that would be my wish if I were queen of the world, to go after that. That would free up a lot of coming out energy, I think.
Mhm.
I'm thinking, Carly, you might be able to answer this for me. I don't know what younger people are doing now as they come out, and where they are, because, to be honest with you, I don't know where to find the lesbian or the women's crowd. When I was young, there was the Women's Coffee House, there was Amazon Books, there was Out to Brunch that was actually active. There was so many activities that women could meet other women and be supported and feel open, go to Anne Reid concerts. She's still playing, but it's like there was so many things. What do women do now? I don't even know where to go to be with people of my like kind. I don't know.
Yeah, I think for young people now, it's all virtual, sorry to say, but it's like, that's kind of where it's at. And I think, yeah, it's the dating apps and it's the online social media that represents the community. I think that's where a lot of people are getting hooked up with other communities, and that's social media type stuff, which then would lead to events and hanging out. I don't know, maybe you just got to wear a gay flag and go out and go for it. No, I'm just kidding. I don't know, it's just, I think everything's really shifted, which is a whole nother topic to think about. Like, how does the online and virtual world, how is that liberated, and how does that also influence the opposite way for folks that are being fed garbage, lies about our communities. So
well, it gives me more reason for us to do our monthly group. I start thinking more and more now as I'm sitting here. Yeah, I mean, this is how, yes, this is within Gilda's, but we got to start somewhere, so our LGBT plus group is once a month. I think the Pride group is really important.
Yeah, I didn't join because I was just feeling like I'm sort of, cancer is in my rear view mirror. It's been, my year of cancer was 2018, and God willing, I won't have a repeat. But for a while, it's not a current part of my life. Once you have cancer, it's always part of your life. But I wasn't really interested in going to the cancer support group. But what you're saying, Kaya, makes me kind of maybe I should reconsider that.
Yeah, the group isn't based it's anyone affected by cancer. So it could be living with loss, it could be post-treatment, it could be going through treatment. It's just, I think the conversations that we're having today, it's kind of basically what we're guiding it as, is building community, more of a social, not a support group. And then, the sky's the limit with what do we want to do outreach? Does our group, what can we do to bring awareness within the medical? What can Gildas do? What can our members do to promote these conversations, to promote networking, connections, working from the top down, so, and then being a support if needed, just having that community to check in once a month and, and I'm hoping that the group is led by what manifests within the group, what the members bring and where it goes from there. So it's more social than a bit like a support group. So
is there any talk around Gildas about when it may be opening again to, in person?
We're talking about it, but I don't have an answer for you yet. We're having many, many conversations about it. So this all of a sudden turned into a Gildas Club plug. It wasn't meant to be that. But
not at all. But like you're saying, right? Like that this is where community can start.
Yeah.
And then we move. Yeah. Like so.
Angel, you didn't get a chance to answer that. What should society do as a whole to help?
Well, I think within our community, and I think Kim, you kind of spoke to this from like people in power, but just people in our own community treating one another with respect and acceptance and love. I have a client who said that they were told they weren't trans enough. Like things like that. What does that mean? So we hurt one another within our own community, and I saw that too when I was working at the Pride Institute. That there was judging amongst our own people, and I thought, well, why are we doing that? We know what it feels like to be judged. We know what it feels like to be dismissed and singled out and things like that. So why are we doing it to one another? So I think, the point about coming out, and I think that that's great. We just need to come out together and be supportive and lift one another up, because we are stronger together than we are separate, for sure.
Have you ever heard of the Quatrefoil Library? Gay and Lesbian Library.
Oh, Quatrefoil? Yeah, I have.
Yeah, that's another place.
Yeah, I was quite involved in everything when I was younger. It seems like it's, just kind of, especially since, I've lost my wife. I think that's made a big change for me.
Yeah.
And just want to share, even though that's not what this group is about, but it was a week ago Tuesday that was 6 years. So I just wanted to share that. And hopefully, you know, medical has changed a little since then.
So now we're going over time, but now you made me think of another question. How did society in general deal with that loss? How was that respected and accepted of your wife dying?
I have to say, actually, they were very good about having me make decisions, you know, because we knew that she was going, and, you know, so when did we want to take the mask off and all that kind of stuff. The medical group was awesome with me around her passing. The only thing that I was really, really upset with, and I don't maybe it's just me, but she passed away at 11:30 at night. A doctor, MD, you know, the nurse had seen and knew, so they called the doctor, but the doctor didn't show up until 12:15. And I said, you know, I want the record to say the 11:30 time or that date. Please don't put today on. And they put that day on. So now I just accept that it's the day after Memorial Day is when she passed. So I don't give it a date anymore because that's the only thing I didn't feel respected with is her actual date of passing. But the cremation was really easy. The people there were very good. I had no problems with, you know, getting whatever things I needed that were in her room. And the memorial service was incredible. I wasn't even going to plan one, and somebody said to do it, and I'm glad I did now. But I was this brave woman that was like, you know, we don't, you know, she died, you know, she's not here. We don't have to do this, you know, we're all of aging, we're all of getting sick, and we're all of dying. But I learned that's another thing I have to be honest that Gilda has really offered me, and also being with people, is that 6 months later is when I finally it hurt. I missed her. And I do till this day, but to have that support of people, and then also having the doctor call and recognizing. And I think also just to add that I had to have some therapy and all that, and I think I really was accepted well amongst the therapy community that I was in, the grieving community, as a, you know, even though there's all different kind, you know, straight and non-straight, but yeah.
Good. This is a great conversation, guys. I'm glad we did this.
And I had nothing to say.
That's right. You said that. You were wrong. So can we maybe go around and say one thing we're taking from this conversation? Is that a good way to close it? I'm taking hope from this conversation.
Community.
Yeah, I'm taking a sense of maybe joining the once a month support group that Gail does.
I think my gratitude, but maybe not gratitude, but for just feeling it for the folks that really fought hard, because I really didn't have to come out when I was 16. It was kind of cool, so coolish. Not as cool as now, but it was on the verge of being cool. So I need to remember the history and keep building community.
He had a fight Anita Bryant.
Yeah.
Thank you.
I went knocking door to door in San Francisco for domestic partner benefits.
Thank you.
Yeah, thank you.
in San Francisco.
Wow.
And I do see, that it is your turn, Carly, and it's not only even, you're younger than us, but I think that we even need the younger folks to
Yeah, absolutely.
not just think, oh, this is the way it is. It's been easy, but
Yep. Yep, I agree.
and all I think of is this whole evening has felt like loving kindness to me. So thank you. And I'm sending hugs to everybody.
Take away no appreciation for why Nancy's so crazy about Gildas. It's there. Yeah.
Yeah, we're pretty cool. I agree. All right, I'm gonna step
See you guys soon.